Germany, like many other nations, has been hit hard by the coronavirus, reporting more than 120,000 cases since late January, according to the World Health Organization. But the number of deaths in Germany has remained lower than many other countries, whether in Europe or around the world. Joining us now to discuss is Germany's Minister of Health, Jens Spahn. Mr. Spahn, thanks so much for joining us. Good afternoon to you.
Good evening from Berlin. Hello.
Let's start on that topic that I just mentioned, if we could, whether we're looking at total cases relative to population, or in particular the number of deaths so far in Germany. It's a terrifying number in absolute terms, but relative to so many similar countries, you've clearly performed a lot better than some nations. Why do you think that is?
Well, Wilfried, in general, first of all, the fact that Germany is doing better so far makes one humble, not overconfident. And there are many reasons for it. I will just outline two or three. One is that we have a healthcare system that is in very good shape. And that is because of a success story, actually, of several governments. We invested in it too, but that is already a good base for many, many years. Secondly, we have a good network of general practitioners here in Germany. They take care of the soft cases to avoid an overrun of the hospitals. So the hospitals can take care of the severe cases. And then, traditionally, we have a high number of ICU capacities here in Germany. We have managed to increase it now in the crisis up to 40,000 ICU beds here, and that is a high number for a country like Germany. So we took it very serious from the very beginning, and that gave us time to prepare.
Oh, it seems as well that your testing capability has been far superior to that of perhaps the United States or the United Kingdom. Why is that? Were you already prepared for this in years past, or did you just manage to ramp up capability very quickly in the early months of this year?
Well, first of all, testing is crucial. It's like pointing a flashlight into the dark. If you don't do it, you just see different shades of gray. With extensive testing, you can really see what's going on. You don't just see the symptomatic cases, but the mild and asymptomatic ones too. And so far, we have tested 1.5 million Germans here, and we are trying to increase capacity day by day. What helped us is from the very beginning that we have a broad network of labs, laboratories all over Germany, traditionally as well. So actually that helped us from the start, and actually the first test in the world for coronavirus, for this one, actually was developed in Germany.
And so, Mr. Spahn, do you think that we're getting closer to a point when Germany will be able to reopen its economy? There's been sounds of good news on that front coming out of Germany in the last week, and then yet just today, about an hour or two ago, President Macron of France clearly pushed back the date for France. So where does Germany stand?
Well, so far we have managed through it very well, but now we need to find the right balance. It's not, I would say, it's not the health of people versus the economy, because they are very much interlinked. You need a strong economy to have a well-equipped health system, for example, or unemployment recession is harmful for the mental and physical health of people too. So what we need to find is the right balance. And now with numbers down, the numbers of new infections per day in the past weeks, with all the measures that we have taken, we are thinking about step by step, that is important, step by step, going back to a new normal. That is important too, because all the measures we have taken, like keeping distance, wearing masks, no parties, that are definitely measures that need to be there in place for months to come. And I'm very proud that our fellow Germans actually follow the rules, actually not because the government tells them to, but because there's a broad support for this. And that is, of course, very helpful, and that gives us confidence now, step by step, coming back to, as I said, new normal.
Mr. Minister, it's Sarah Eisen. It's good of you to join us. We're also wrestling here in the U.S. with the question of how and when to reopen the economy and get people back to work. I know you guys have done some experimentation with the antibody test, the serology test, especially in that hard-hit municipality of Gangelt. What have you learned? Are they accurate, and do they signal that people can actually go back to work? Are people being infected at a big enough scale to do that?
Well, so far there is no antibody test in place, at least as far as we know, that really is good enough to really take the decision if people are immune enough to go back to work, for example, in critical infrastructure like hospitals. But our people, our experts assume within 2, 3, 4 weeks we might have these tests, as they are already tested, as you mentioned, in the region of Heinsberg. And as soon as we would have them, that is, of course, a real game changer. If I might add something regarding production in Germany, for example, car manufacturing factories were not brought to a standstill by political decisions. That was a decision by the companies because many markets are inaccessible right now. And this is not a good time to sell cars to the world, obviously. And so actually many of the production lines in Germany are not working right now, not because of political decisions, but because of not having no access to their markets.
Germany's rates of mortality are so much lower than that of Italy, as Wilfried mentioned, even with a bigger population. I think it's 8 times fewer deaths, but also lower than that of the United States. What are you doing that we're not doing? I mean, we also have a very strong healthcare system in this country.
Well, actually, as I said, all we did and we tried to do is prepare as good as possible. And to actually take care of patients as soon as possible, especially with the general practitioners, taking care of the soft cases. Because what we see in some countries is that people only show up in the health system when they are already in a difficult, critical status, and then coming to the clinics. And what I find important is to try to reach out to them as soon as possible and to treat them as soon as possible to avoid as many severe cases as possible. And then, of course, our ICU capacities, the ventilation systems we have here in Germany. I'm very grateful and humble, actually, that we had this big base, this big number we could start from that really helped us in this crisis. For example, 3 weeks ago, we asked all hospitals to postpone elective operations. And by doing so, within 10 days, we had 10,000 empty beds in our ICUs. And most of them are, by the way, still empty and can be used for whatever comes.
Mr. Spahn, I wanted to ask about the long-term future of the European Union. I mean, free movement of people was such a central tenet of the EU, and clearly it's not happening at the moment. And at the same time, there's a lot of clashes on the shape of bailouts, on Eurobonds and the like. Do you think there's long-term damage been done to the unity of the EU?
Well, Wilfried, this is definitely a stressful time for the European Union. And as too often in a crisis, at the very beginning, the European Union seems to be very disorganized. But I would say now we have pulled the ends together and we are standing strong in this. We are helping each other. For example, Germany is taking patients from other countries here to Germany to treat them in our hospitals from Spain or France or Italy. And then there is, as you just mentioned, of course, the economic dimensions. With this 500 billion euro package that was negotiated by the European financial ministers in the past days, I would say we have a good base to help to support those who need economic support in this crisis. And at the same time, we don't set the wrong incentives for the future. That's a good balance between financial soundness and European solidarity that was found. And that shows, after some problems at the beginning, that were there definitely, Europe and the European Union is back on track.
The COVID-19 outbreak came to Germany on January 19th, when a businesswoman from Shanghai arrived for 2 days of meetings near Munich with her German partners. After she was diagnosed a few days later, her contacts were quickly traced and tested, and the first cluster of infected Germans was identified and isolated. Dr. Uwe Janssens leads the German Intensive Care and Emergency Medicine Association.
And she infected this man infected 5 others, and in the end we had 16 patients. And then nothing happened more.
Then came spring break, when many German and Italian students make their way to the alpine villages of Austria to go skiing. It turns out there was one super spreader in the town of Ishigo, a bartender who thought he had a cold but was not ill enough to skip work. He infected hundreds of young people, including many Germans. Martin Sturmer is a German biochemist who was himself caught up in the epidemic.
Yeah, we've been to Austria for skiing, and 2 days before we left our holidays, we got a message that the complete region of Tyrol is called the risk area. And when we came back, because my wife and I, we work for a medical lab, and they said, before you come back to the lab, you have to be in quarantine, and we will have to do a test. And so we did a test, and it was positive.
He just kept going to work. I guess he didn't feel sick enough to stay at home.
Yilmaz Gulum reports for Austrian Public Broadcasting.
There was not yet an understanding of what could happen. Up to 50% of people who have the virus don't show any symptoms at all, and a very large number of people show only very, very mild symptoms. Now, it depends on the capacity of a country to test. How many people can a country test per day to isolate the people that are infected, to isolate them from the rest of us?
Chancellor Angela Merkel, a scientist by profession, was the first Western leader to take action about COVID-19. She estimated that up to 70% of the German population could contract the virus.
That was the first time that for me, my perception of the whole situation changed. And when she said up to 70%, I just made a quick calculation in my head that if 1% of infected people die, which was at the time the assumed fatality rate, but all right, 70% of Germany and 1% dies, that means roughly 500,000 people will die in Germany. And that was for me like, whoa, this is not just the flu. This will change a lot of things for a long time.
Germany quickly began developing thousands of test kits, far more than any other Western country. Germany has ramped up quickly and is now testing 500,000 people per week.
For instance, everybody coming from Italy or from skiing or from the risk area in Italy, he was isolated and was tested, and everybody surrounding the family was isolated. So I think at the moment, this led to the point that we don't have so many old people getting infected.
So if you look at our overall positively tested population, you see many younger people below at the age of 60, which have been tested positive, and therefore we have not so much severe ill people in our population, in our testing population.
And everyone just started to test, to establish the test as soon as the sequence.
Melanie Brinkman is a German virologist.
And I think that's the big advantage we had. And I like to compare it to an iceberg. So I think we saw a much bigger tip of the iceberg than other countries, as Italy, for example. And I think we have gained a lot of time. And now had time to prepare the hospitals for the patients that will come eventually.
Once the wave of infection arrives, Germany will be far better prepared than other Western countries to handle it. For example, Germany has invested in a greater per capita proportion of intensive care beds and ventilators, almost 3 times as many as Canada.
In Germany, there are a lot of hospital beds per capita and a lot of ICU beds per capita. For example, in Germany, we have 34 ICU beds per 100,000 inhabitants. That's a lot. For comparison, in Italy, we have 8.4 per 100,000. And so this is fourth the times, we have fourth the times of beds. So I think we can handle this situation a little bit better than the Italian people do.
Many German experts feel that the country's low fatality rate of COVID-19 patients has a lot to do with the relatively low number of serious cases they are dealing with, but that could change. Dr. Karl Lauterbach is an epidemiologist and member of the German parliament.
I think that the tidal wave is coming, and we will see, let's say, a sharp increase in both the number of infected infected people and also the number of, let's say, people having severe disease and people dying, unfortunately. So that will happen. But I do assume that we will not get close to the numbers, I hope at least, that we unfortunately currently observe in France, Spain, or Italy.
So I was lucky at the end, and yeah, but I think it hasn't changed my point or my view on the complete epidemic. We should respect the virus, should respect the illness, but we don't have to be at the panic mode and don't have to fear this infection.
Right now, Germany has many fewer COVID-19 deaths per capita compared to their neighbors. Almost 7 times fewer than France, 30 times fewer than Spain, 35 times fewer than Italy. But experts here insist that does not lead to overconfidence.
We are not becoming overconfident at all. We are very well aware that in a couple of weeks we may be in big trouble.
In the town of Minden, a symbol of Germany's determination to win the battle against this virus, this school gym has been outfitted to receive anyone who is caught disobeying quarantine restrictions.
Beratschlagen und wenn alle der Meinung sind.
First Alderman Sebastian Arlt says the forcible confinement will be accomplished, if necessary, with the help of the police.
Unterstützung der Polizei durchsetzen.
Germany has given the world a positive lesson in how to deal with this pandemic. Terence McKenna, CBC News, Toronto.